Hi, my name is Angelle and today I'm going to talk about forward head postures and different exercises and stretches we can do to avoid it. So what is forward head posture? So this is a posture that a lot of people attain because of activities that they do daily. This can include driving, if you do a lot of driving for work. It can be if you work at a desk and maybe your workstation's not set up well, you can't see, you get into a little bit of a forward head posture. And then number one, our phones. Everyone is looking down at their phone, texting, surfing the web and such. So a lot of times when you're in these postures for long periods, your muscles want to go to the position that you're in most. So this is, for example, a forward head posture. So why is it so important that we discuss this? Well, the human head weighs about 10 to 14 pounds. And so when you're in a forward head posture, it actually exponentially increases the stress and the load on the spine. It causes some muscles to be weak and other muscles to be on stretch. Your body's not designed to do this, and therefore can cause pain, muscle adhesions, just tightness, weakness. It can lead to many other things. So this is why this is so important, and because so many people are doing computer work on their phones so much, it's so important to catch this now. So with forward head posture, there's typically a muscle imbalance. Some muscles get tight and some muscles get weak. The muscles that tend to get tight are the upper trap, these muscles right here, and then the levator scap. And I'm gonna talk more about these muscles later. These are very common ones I find in physical therapy that have a lot of trigger points. And also your pectoralis muscle, this muscle in the front, just because you're in this, your shoulders are forward. Which muscles are weak? Typically your neck flexors are weak. And then some posterior muscles, a muscle called the serratus anterior, which is a muscle underneath the shoulder blade. Your lower trap, and your rhomboids, which is a muscle between your shoulder blades. And those are going to help stabilize and get you in upright posture. So we really want to make sure that those stay strong. So I'm going to talk about 5 exercises / stretches that are going to help counter that posture. The first thing I want to say is that these should not be painful. If these exercises are painful in any way, you need to stop. You can always contact a physical therapist. We can see if there's something we're doing wrong, that you maybe not doing it correctly, or it may not be the exercise for you. So don't go through it if there's pain, okay? The next thing is, for a lot of these, you want a good comfortable chair where your feet are flat on the ground. So the first one I'm going to talk about is called the cervical retraction chin tuck. And so what we're going to do with that is pretty much the opposite of the forward head posture. So I'm going to turn to the side here so you can see it a little bit better. So what you're going to do in this exercise is you are going to pull your head back and your chin down, like so. It should not be painful. It should be a nice, smooth motion. And you can feel a little bit of stretch in your muscles as you're doing that. You just hold that position for about a second or two, do about 10 to 15 reps, and you can always build up with your repetitions with that. But that's a really good exercise to help maintain a good posture. The next few I'm going to talk about are some stretches. So one of the muscles I was talking about that tends to get tight is the upper trap muscle. The upper trap muscle attaches from around the clavicle and then all the way up to the base of your skull here. So how do we stretch that? What you're going to do is the same side that you're stretching. I'm going to go on my left today. You're going to either push that arm down, or you can hold on to a chair. And then what you're going to do is you're going to bring your ear to the opposite shoulder. So I'm stretching this side here. And then what you can do is bring your hand on top of your head and give yourself just a little bit of overpressure, just so you feel a gentle stretch. And then we're going to hold that for about 20 to 30 seconds. I'm going to hold it for a few seconds here. Stretches, you always want to hold a little bit of a longer duration to make sure you're getting lengthening of the muscle. And then we could come up and then we'll show you the other side. Make sure your shoulders are relaxed with these, that your arms are not going up, because then we're kind of defeating the purpose. So we'll hold that for about 20 to 30 seconds. You could do about 3 to 5 on each side. It should be just a stretch you're feeling. The next muscle I'm going to talk about is the levator scap stretch. So this one is one that I talked about, attaches from the inside of the shoulder blade up to some of the cervical vertebral segments. So what we are going to do to stretch that is the side that we're stretching. I'm going to, I guess, stay with my left side here. We're going to bring that arm up and back. So I'm just going to turn so that you can see. So we're turning that arm up and back. And that's just going to kind of stabilize. And then what we're going to do is we're going to turn our head toward the opposite knee. So I'm turning it to the right since I'm stretching the left. And then I'm going to give that my hand. I'm just going to give a little bit of an overpressure. We're going to hold for about 20 to 30 seconds. We'll count those about 20 to 30 seconds. We'll come up and we'll do the other side. So I'm going to do for that is I'm going to bring that arm up. Just bring that arm right there. It's just sitting there. And I'm going to turn my head to the side and down. And I feel a stretch in that muscle. It's right here. And we just hold that for about 20 to 30 seconds. And we would do that about 3 to 5 times on each side. So the next exercise I'm going to show you is for the pectoralis muscle. So the pectoralis muscle can attach from the ribs and go into part of the shoulder. So I'm going to show you a few ways. This is one that is really good to stretch because a lot of people kind of start getting a rounded shoulder. So I'm going to show you a few different ways you can stretch that. So first, if you have an open corner in your room, you can close a door. What I'm going to do is I'm going to bring one leg forward and I'm going to bring my arms on the wall here. And then what I'm going to do is my feet are just staggered just a little bit for balance here. And then I'm just going to kind of lean into it till I feel a stretch in the front of my chest. And make sure that you're not bending forward, you're not looking down, that you're looking straight ahead. And you're just going to hold that for about 20 to 30 seconds. So I'll just hold it there. And then what you can do is you can even, if you don't have for some reason that shoulder mobility, you can bring your arms down. You can bring them down here and get a little bit of extension. You can bring them up, which is even a little bit harder. You can modify it as you need to. Another, if you don't have a corner, I'm going to show you a way you can use using the doorway. You're going to bring your opposite leg forward of the arm you're stretching. You're going to bring your arm up on the door, and then I'm just going to lean into it until I feel a stretch. Same thing, I'm going to hold it for about 20 seconds. Okay, and then we would do that on each side. All right, so I've got one more I'm going to show you, and it is called scapular retraction. So what this is an exercise to strengthen one of the weak muscles I was talking about. So this is the muscle that is between your shoulder blades. So what you are going to do for this exercise is just make sure you're sitting nice and tall, your shoulders are relaxed, and what you're going to do is you're just bringing your shoulder blade, you're just pinching them together. Now you're not shoving them back, you're just pinching them together. And I'm going to turn and you can come and show from the back what it looks like. And this one you would just hold for about a second or two, and you can do 10 to 15 repetitions of that. Okay, I do have a progression for that. If you have a band at home, you could either sit or stand. And come back over here. You can tie the band to a doorknob, and then you can bring your arms out and then just pull the band. And while you're pulling that band, you're just squeezing your shoulder blades together. You're starting good, nice upright posture. You're starting with about 10, 15 reps and just kind of going from there. Okay, so those are 5 quick exercises to counteract the forward head posture. If you have any questions, please contact us at Rehab Dynamics. Have a great day.